Prescription pill abuse is a growing problem throughout the country. Doctors saying what they consider to be the gateway drug is changing.
I speak with our medical expert about what he describes as a growing pandemic and what you can do about it next.
It's an epidemic that is sweeping the nation, including right here in Midland, Odessa. Our medical correspondent, Dr. Bose, takes us inside opioid abuse, why it's becoming more popular, and the potential dire consequences for our community.
Have you ever had a runner's high when you're running?
Yeah, of course. You feel good. It makes you happy.
You feel good. When you're running, your body releases a substance, a natural substance called endorphins. It sticks to the receptors on your brain that those receptors are the pain receptors and the reward center of your brain, and you feel good. And there's a class of drugs called opioids.
Yes.
And opioids, they hit the same receptors that endorphins hit in your brain, that pain center, that reward center. And when you have that, you feel good, and human behavior is you want more.
Yeah.
And this is what's contributing largely to opioid abuse in our country. And there's legal opioids like morphine, which we prescribe, and illegal ones like heroin, which causes many deaths in this country. And so why are we having this opioid epidemic? It's a lot more than just feeling good and wanting more. That's a big part of it. But it's everything from government decisions. It's border control and what's coming into our country. It's lobbying. It's pharmaceutical marketing. It's physician satisfaction scores. Physicians are pressured to, and they want to make you, happy and decrease your pain.
But in turn, people are getting addicted to these things, and like we've talked about, it is the gateway to drug use, hard drug use, heroin. And it's scary in the face of a drug addict. It's actually changing. It's not what you would typically think. It's the college student, the stay-at-home mom.
Exactly.
People that you would never think that would have a problem.
How many heroin users started heroin because they first received a prescription opioid medicine?
This is a very scary statistic.
75%, 3 out of every 4. So, like you mentioned, groups you never thought would think about as being heroin addicts, the wealthy mom, things like that, they're becoming heroin addicts, and they're dying from it. And I'm concerned about this being the gateway drug, not marijuana, which we always think about.
Which we've always talked about and thought about, but
as being the gateway drugs. Exactly. So I think the lesson for you guys out there is you have to trust your doctor, who's going to try to give you the right medicine for the right situation at the right time.
And know that pain is part of life. When you are healing, pain's part of it.
It is, and it's okay to feel some pain. Just like when we talk about world events, in order to bring peace to a region of the nation, or a region of the world, unfortunately, there has to be the pain of war. And similarly, our body is the same way. In order to bring peace to a region, we have to experience pain. Sometimes that's rehab. Sometimes that's weightlifting. It's painful, but your muscle grows back stronger. So it's okay to have pain when you come in. It's okay to have pain sometimes. And you have to wean off those opioids and use them only when necessary.
Right.